Go ahead.
Okay, perfect. So I would like to welcome everybody to Navigation Series Heart Failure, the self-management portion. Today we are very fortunate to be able to have the American Heart Association presenting today. I'm going to take care of a few housekeeping things before I introduce them. To obtain nursing contact hours, you must have entered your license number at registration. You must be logged in individually with a unique email address to the webinar for the full duration of the presentation. There will be no partial credit available. Nursing contact hour certificate will be emailed to you. There will be a certificate of attendance that will be emailed as well, with a evaluation to complete afterwards for nursing licensures. So today we have Preeti from the American Heart Association. She's a Senior Patient Engagement Manager, where she oversees the Rise Above Heart Failure initiative, as well as other programs, including those reaching and educating patients and providers about AFib, heart valve, and support network. We will be also having an ambassador from the American Heart Association joining us as well, hopefully. Her name is Amy Rodriguez Zepeda, a mother of 3 from Woodbridge, Virginia, survived cancer and was diagnosed with cardiomyopathy and heart failure. She was determined not to let her chronic heart failure diagnosis stop her from pursuing her passion, which is riding motorcycles. Last spring, she organized a charity ride in her hometown of Woodbridge in Virginia to raise awareness about heart failure in conjunction with the American Heart Association. As an ambassador, she is committed to raising awareness and providing encouragement to others dealing with heart failure. So I'm going to go ahead and have Preeti start her presentation on self-management tools and resources from the American Heart Association.
Thank you, Jen. Thank you for the wonderful introduction, and thank you for all those of you that are attending here today and spending your lunch break here with me. I'm honored to have the opportunity to speak about the work that our team does in the heart failure space. Hold on. So really the objectives of this webinar are to review the growing heart failure epidemic and the impact it has across our systems of care and the country. To touch upon the pathway to self-management for heart failure patients and why that is so important, and to learn about the various tools and resources that we at the HA have developed to help your patients manage their condition. And finally, as Jen mentioned, one of our goals is really to also have Amy share her story. Hers is a very inspiring story, and she is one of the patients and our ambassador, and she will speak about her journey and how she has been able to get onto the path of self-management. I think all of us here today at this webinar are aware of the growing heart failure epidemic. Right now we know that 1 in 5 Americans will develop heart failure in their lifetime. And, as you can imagine, with a growing population and people living longer lives, that is just going to become more and more prevalent. More than 6 million people today live with heart failure, and an estimated 8 million is what we think will be the number by 2030. What we also know is that there are an estimated 960,000 new cases of heart failure each year, which then just speaks more about the burden and the impact that it has. The impact of heart failure on health care is something that each of you probably see on a day-to-day basis and experience. What we know is that, from NHANES data shows us between 2011 and 2014, 6.5 million Americans greater than 20 years had heart failure. And this is projected to really increase by 46%. In 2012 alone, the total cost was estimated to be over 30.7 billion. And of this, while 68% was attributable to direct medical costs, and which is projected to increase, the rest of it was really the indirect cost, the cost associated with work loss, household productivity loss, premature mortality. And, those numbers are staggering because of the impact it has, not just on the patient, but also those that take care of the patient, the unpaid caregiver, the family members, and the impact that it has on both their lifestyle, their head, and their livelihood. So you might ask, how are we addressing these projections? What we know is, low literacy level can really act as that barrier to effective heart failure management. People are not able to understand what the condition means, how it can affect them, long term. But more importantly, we want them to understand that, with self-management, they can have, an improved quality of life, and they can have their condition under check. What we are really trying to do with our work is to change the conversation from it being, this sense of, 50% of those diagnosed within 5 years will not see more than that, to being more of a message where, if you are able to take small steps and get to behavior change, understand your condition, you can lead a longer life, and you can have an improved quality of life. But there is work to be done, like any chronic condition. And in addition to that, with improved self-management, which will help increase compliance to adherence to treatment, it of course has the added benefit of decreased hospital readmissions and decreased hospitalization costs as well. One of the work, while AHA does a lot of great work in the advocacy space, as well as in systems of care, as many of you that might be participating in Get to the Guideline hospitals, heart failure hospitals, and Target Heart Failure know, we do a varied amount of work, that really stretches across the continuum of care, from patients to advocacy to changing systems of care, and of course, science and research through our evidence-based guidelines. Really, one of the efforts that my team in particular, which is the patient portfolio team, works on is a really large awareness and education effort called the Rise Above Heart Failure Initiative. Our goals through this have been, over the years, first engaging and educating the public to raise that awareness about heart failure, the signs and symptoms, what it means, what the terms mean. And then through a process, to a systematic approach of education, through, having ambassadors that can share their stories so that people identify with, through media outreach and social media, to reaching out to healthcare providers such as yourselves, providing them the resources that it takes to really facilitate that conversation with the patient, and then just integrating across the different teams that we have to build out and improve hospital discharges and help with outpatient management. What I'd really, like to maybe first touch upon are a few resources that we have available for providers and folks such as yourselves. Over the past 3 years, as we've worked on this initiative and built it out, what we've really tried to do is listen to the needs in the marketplace and provide information in pieces that really help you as you do your work. One of the things that we have within this is our Rise Above Heart Failure Provider Toolkit. This toolkit is available at the link that you see right below here, which is heart.org/RAHF toolkit. It's also available in a WebKey form that I'll pass on to Jen, that she can order for you all as well. There are a few different components. The basic component is that it is an interactive go-to guide. So it is a digital form What it has is embedded links to heart failure resources for patients, as well as a conversation guide that helps and teaches and guides you on how you can have that conversation with your patients about heart failure. What does a condition mean for them? What is it? What is it? How do you communicate? What is important for them to get on to self-management? How do you speak to them about taking care of themselves, watching their diet, being adherent to the medications that they have, and so forth. It includes also a teaching checklist that you can use both at the point of diagnosis to ensure that you're following evidence-based guidelines for care, as well as at the point of discharge, more to ensure that you're touching upon all the different factors that are important for a heart failure patient to not come back to the hospital, because, they've suddenly had a hamburger and, they've increased their weight by 10 pounds because they don't understand that they need to watch their sodium, and so forth. So it's in a very practical way. It gives you pointers, and it also helps you check out all the different lists so you know that you've covered the points to help them manage their condition better. The other kit that we have, that is really focused on our guidelines. As you may be aware, AHA, along with its group of volunteers, which include practitioners such as yourself and researchers, and people, all the different stakeholders, look at the guidelines for treatment for heart failure. And, every few years we build out, what science tells us, what the new science tells us based on, they review many papers and, look at a lot of new research that has been done. And the most recent update to our guidelines happened just last year. So we built out, while we have a lot of different resources and we have a lot of webinars and so forth, one of the things that we built out that we thought would be really helpful to providers was a heart failure provider guideline toolkit. Again, it includes, a one-on-one go-to guide. It has the treatment algorithm. It explains the different types of heart failure. And again, it really helps clinicians in the post-acute setting identify the high-risk patients and really guide them towards what the best protocol is to treat them. This, again, is a tool that is available at heart.org/HF Guidelines Toolkit. We also have web keys, which, again, I'm happy to have pass on to Jennifer, post this webinar as a follow-up that we can order for you and have sent out. So you have these resources on hand that you can then download to your computer or laptop as well. Now, getting to what we're doing to getting patients on the path to self-management. What we know is that small changes to your lifestyle can really reduce your symptoms and improve your quality of life. We have, following recommendations about diet, exercise, and habits can really also help alleviate your symptoms and slow your disease progression and improve your everyday life. In fact, we also know that people with mild to moderate heart failure often can lead nearly normal lives if they are to follow, simple steps that helps them understand their disease condition, and as well as, watch their activity, physical, and watch their, really all the different parameters that we look. Within the AHA, we call these 7 parameters for healthy living called Life Simple 7. And this really is the basis for all the work we do to improve people's cardiovascular health. Life Simple 7 includes, certainly taking care of your diet, your exercise and physical activity, your blood pressure, your cholesterol, taking care of stress, taking care of maintaining your blood sugar, and overall, just management and understanding what healthy living looks like. So really for heart failure patients, the diagnosis can be pretty devastating, because of the word around heart failure. So for a lot of people, they're not in a position to hear anything more than that. So what we have tried to do is really help patients understand what it means to have heart failure. We've built out a lot of great resources and videos and infographics. And our goals are really to start that conversation by helping them understand that this is not a death sentence, and really based on at what point the diagnosis happens, and that they can start on a path which can help their quality of life, and really teach them about what it is that's important about keeping their symptoms in check. Right at the top of the funnel is, do you understand what the symptoms are? What are the things you should look out for that can be easy to manage? And then following that, what are the simple things that you can do to your diet and your activity, and starting with that knowledge base, The second thing that really are resources that you can find on our website at riseaboutheartfailure.org. The next thing that we really teach is, once you know the basics, once you understand what your signs and symptoms are, what does ejection fraction mean? How can I, once a patient is able to understand that and the caregivers are, following that, it's then easy to help them understand the importance of, tracking and reporting symptoms, measuring their fluid intake, their sodium intake, tracking their medication adherence. A lot of them live with multiple comorbidities, and, understanding what it means to keep taking their medications. And if they do find things that aren't working for them, they need to be proactive about getting together with their provider, with their healthcare team, to really help with that. Because especially for a heart failure patient, there is such a large team of professionals and teams that take care of their everythings. And of course, the importance of keeping physically active and getting adequate rest. And finally, the third step to, once they get into that habit of tracking and then repeating that every day, you're now getting on the process of getting into a habit, and then slowly that helps you get on the path to behavior change over the long term. Finally, our goal is to seek and give support. And this is something that is common across a lot of different conditions. Oftentimes when you're in this journey of recovery, when you get this diagnosis, you feel that people may not understand you as much. And that's where support networks come in. Finding a network of people that understand you, finding a group, whether it is in person, whether it is online. We certainly have online support systems. I know a lot of patient, hospitals and systems across the country have in-person navigations through Mended Heart and other organizations. It's really important for them to understand that there is a team around them of like-minded people that are there to support them and to help them get to that better place. In terms of resources available, we certainly have a lot of great resources that we're proud of. One of them, as I mentioned earlier, is our Rise Above Heart Failure website, which is on the heart.org conditions page. If you look under heart failure, we've just given it this name so it's easier to remember. Within that, we have a lot of interesting, interactive, engaging resources. As I mentioned earlier, we have videos. Our reduced ejection fraction video that you see on the top middle has been an extremely popular video. We've had hundreds and thousands of people that have already viewed it. Our most recent resource, something that we just put out just this past week, has been an interactive resource that speaks about how a patient can improve their low ejection fraction, which is possible for certain types of heart failure. This is something we just reached because we kept hearing that story. We kept getting that question within our patient community saying, what can I do to improve my ejection fraction? Are there things I can take care of? Are there things that I need to be aware of? And so this resource came out of those questions that we heard. And this is a 2-page document that someone can take and print out, take a look at, and really track and monitor. It also gives them questions to ask their doctors, at their next visit. So in that way, we hope it helps them start at least getting to ask questions at the very least. And, even better, give them some tips that can help them get on a better path. Finally, our self-check plan is extremely popular as well. As you can see, it is, it's color-coded, and I'm excited to also share we've actually transformed that into our app as well. And then, partnering in your treatment is another great resource where, it really gives them a checklist of sorts on the different types of questions that they need to keep in mind for, and to help them think through what they need to speak to their doctor about. And finally, we have a guide. It's an interactive guide called My HF Guide. This currently in target heart failure is the recommended 1 hour of education that we recommend we give our patients before discharge. And this, again, goes through a lot of different resources that are available on the website and actually compiles them into one place. So it goes through all the different things that I've spoken about and just helps give the patients a primer on what they can expect, what this condition means, and what are some of the steps that they need to keep in mind so that they can get on a path to better health. As we've evolved our programs, as we've evolved our programs, one of the things that we've realized is that there is a need in the marketplace for patients to have a tool that helps them track and teaches them and gets them on the path to management. And one of the things that we released just this past year is an interactive web and mobile app tool called HF Path. Our goal with HF Path is really to help patients control their symptoms and adherence to treatment through different trackers, to help them learn how to manage their condition through interactive small lesson plans that they can go through on a week-by-week basis. And then finally, help connect them to other patients and people who are going through a similar experience or journey through a group chat function that is available on the tool. What the tool also does is that there are opportunities within the tool where we can certainly look at exploring, where as a coach, a provider can come in, invite patients to their tool, and then monitor them remotely through this tool. Because as a coach, you will have the option to come in, monitor your patients. If they give you permission to see their data, you can see that. And in that way, you can set up challenges for them. You can make sure they're adhering to their medications through the trackers that you're able to see. And all of that. From our perspective, what we do is we get de-identified aggregate data that we're able to share. And what this tool also does is, as part of the onboarding, it gives us a baseline of where patients are with their quality of life. And then, through a qualitative, the Minnesota Quality of Life Heart Failure Survey. And then at the end of the program, at the end of 12 weeks, patients are required to take this activity again, and we're able to compare where they are. Our goals really with this are to prevent them from going back to the hospital, and to be able to be proactive about what they're seeing with their condition so that they don't reach that place where they're back in the ER, within a few days. So you might wonder how this works and, how all of this really fits in. So, it starts, if you were really to look at an overview of the pathway, there are three big buckets. So you have your onboarding, then you have staying on course, and then continuing the path. So the onboarding section is really the first piece where people come in, they, get on board, they set up, so they get a video which really explains how the tool works. They set up all the different trackers, they set up all the medications. We know some of them are on 20 plus medications. And then we really help them learn how the tool works, Following that, there are 12 courses that we have that run the gamut. These 12 courses start with the basics. What is heart failure? Going on to how do I speak to my provider about my condition? To, how do I manage medications? Why is it important to stay important on medications? Is symptom recognition and tracking important? Along with lesson plans on blood pressure, on cholesterol, on diabetes, on managing my blood sugar, the importance of physical activity, managing stress, and also the importance of social connections, and all of that as well. So these 12 lesson plans look at information in bite-sized portions. They include videos and infographics. So it is an interactive method for the patient to participate. And typically at the end of some of the lessons, we also have a short, just a short couple of questions just to make sure, to see if they've understood what we've tried to teach them. So in terms of the trackers we currently offer for this tool, we have of course, our symptom tracker that we spoke about, which is really interactive. There is a medication tracker. There is a physical activity tracker, and it connects to the majority of our step trackers like the Fitbits and Apple Health. There is a blood pressure tracker coming up, and we also have a weight tracker as well. And we're looking to enhance it with some other trackers as well. And I think I mentioned the medication tracker too. Once they've completed these 12 courses, really, then there is an ongoing process. And that ongoing process is just continuing with your tracking, continuing to take your medications on time. There are reminders that are sent. You can set up when your refills are due so that the app will send you a reminder to tell you to order your refills. It reminds you each time during the day when it's time to take your medicines, and you've got to click on it to let it know that you've taken it. So in that way, it continues to, and it learns, what you're doing, and it helps in that way as well. So this tool, sorry about that. Whoops. This tool is available on the App Store or on the desktop. You can access it by going to heart.org/HFpath. When you first start, what you're seeing out there are some of the screenshots. So you have your quality of life that you complete to get your baseline data. And then you can start by tracking and taking your health lessons and communicating with other users. And then following that, you really stay connected through your mobile phone and your phone, because the app will, you can set it up so it sends you notifications. If there are new resources that we create, we're able to get to these people to inform them of these resources. So from a patient perspective, they get access to all the latest resources that we have, and at the same time, they get a community of people that is so important in really looking at heart failure and improving the quality of life. Our goal really is that when you look at all of the resources that we provide, along with the support network, we are providing both the practical resources that you need. We're trying to get people slowly, once they get that base knowledge, to move them towards self-management, and also get to emotional support, which is where the support network comes in. So our support network is really an online portal that facilitates emotional connections. And the goal out there is to help people feel that they're not alone in their journey to recovery. We have three main goals when we looked at the support network. AHA has always been great at providing practical resources and guideline-based evidence care and looking at our advocacy efforts. One of the things that we heard from those that came to us was, we need a place to connect. We need a place which can help us get to and learn from others who are in our journey. And this virtual support network really helps us in that. Our goal is not only to facilitate those emotional connections, but also in a step-by-step way, improve their knowledge, their healthy behaviors, and ultimately their quality of life. Research has shown that peer-to-peer support can really lead to improve outcomes in chronic disease management. When you look at peer-to-peer support, not only is there informational support given, which is, sharing your experiences and information and learning from what has worked for other people. But there's also the emotional support aspect, which is that encouragement and reinforcement and that decreased sense of isolation that a lot of patients feel. And then once they get both of those, then there is that mutual reciprocity where you share with problem solving. You look at problem solving, everyone gets and receives help on medical issues. And that in turn leads to increased confidence and perceived social support with positive moods, because we know that emotional well-being plays such a big role in feeling good and taking care of your health. And all of those are then seen in results that include improved quality of life, improved health behaviors, improved chronic disease control, and ultimately decreased hospitalization and mortality. So the long-term effects of emotional support are so huge and varied that, when we start with the basics, you're just leading the patients again to that path of self-management and improved quality of life and improved disease condition and chronic control. With our support network, within the heart failure space, our patient support network has over 120,000 registered members. And even just over the past year, it had over 550,000 people visit the site. The site is an open site. So to gain information and to learn, you don't need to be a registered member. You just need to be a registered member if you want to go ahead and if you want to go in and speak about them and get some information. What the network also does is it provides a wide variety of resources. We have blogs, we have survivor stories, we certainly have forums across the disease spectrum. Heart failure is amongst our more engaged groups. And in addition to that, we provide volunteer opportunities where providers come in and they help answer questions for patients. So all in all, it is a combination of, patient support as well as, emotional support and practical resources and information. What you can see out here is, some of quotes that we've had from some of our users on that. Within the support network itself, we also have our heart failure ambassadors. And these are a group of engaged patients that are living with the condition. They share their struggles, they share their wins, they share their journey. And our goal with this is to help people understand and help these people be the spokespeople for the disease condition. because each of them has a wide and varied story. One of and so for instance, we have a set of twins that are also healthcare providers. They actually run their own diabetes clinic, but they were diagnosed. This is not what we typically learn about heart failure, with it being a really aging disease condition. Many of them are in their early 40s or 50s, but they're doing their best, and they are a source of information and inspiration for our patients. We have people that have gone through multiple surgeries, have had transplants, so overall we've looked for a diverse group of people that have come to heart failure in many different ways. And our goal with this program is really to raise awareness and help them understand what their condition means. And one of those people that we have today with us is Amy Rodriguez Zapata. And I know Jen introduced her previously. And Amy, if you're on, maybe you'd like to introduce yourself.
Hi, how's everybody? My name, as she said, my name is Amy Rodriguez Cepeda, and I am dealing with heart failure myself. I just wanted to kind of take a moment and give everybody the perspective of it from the patient. There's good days, bad days. Unfortunately, it's a bad day today, so my apologies on being tardy. One of the things that for myself that I do, when I first got diagnosed, obviously you have a plethora of feelings. You have, depending on what you have going on in your life, you're worrying about those things. For me, it was my kids, children. It was my children I was worried about. With work I was worried about. With school I was worried about. So all of these things changed for me, and I think one of the most important things that changed for me is it made me realize, one, you can't take nothing for granted, and two, it was that I had to understand, I had to learn how to find my new normal. And I say new normal because now it's normal for me, and things how I had in the past were and are not as that way anymore. One of the things that I think got me through was learning how to assist or help other folks, learning how to be an advocate for myself. And I got really lucky to where a lot of patients don't get that. I have a doctor, and I mean, he's great, and he was just very honest with me. He was very upfront. And just letting me know that, hey, there's some major life changes that you're going to have to. One of the first things is I love salt. So that was one of the main things that had to change. So, no salt. You have to be careful with your soda intake. My apologies. I'm so sorry. You have to be really careful with your sodium intake that you take. You also, not only with the sodium, you have to be mindful of what you're doing outside. One of the things is my youngest son, he played football, flag football. And one of the things, that happened to me at one of his meets is, I'm kind of there watching his stuff. The heat don't really agree. So I would find myself sometimes during his games, maybe falling asleep. And it wasn't that, I didn't care or wasn't paying attention. It was just, it's exhausting. Being out in the heat directly getting you. I love motorcycles. I'm a big motorcycle enthusiast. So one of the things that I personally had to learn that, to where in the past I'd ride to places like Tennessee and those type of places. I notice now whenever I ride a long distance, I have to slow down. I have to stop just to kind of get my energy back, which I think that was the hardest. Another one of the hard parts for me is learning that I'm not going to have that energy anymore. But, with a proper diet, these things are good. One of the other things that I'm a part of is I have a CHF team, or a congestive heart failure team, that their function is to monitor me. So I don't know if you guys can see it, but I'm hooked up to a monitor, which is a normal watch. With this particular monitor, it monitors my heart rate. It also monitors my weight. So I have to check in on a scale every morning. If I don't check in, they call me. Um, it lets me track all of tracks my weight, tracks my heart rate. It tracks it also, and one of the things I like, it also gives me little badges. So it tracks my sleep also. So one of the good things with this is, as I stated, it gives me little badges whenever I do good. Say one day I only get 5 hours of sleep, so it will fluctuate something that lets me know, hey, you only got 5 hours of sleep. Your goal is to reach 8, and it lets me set goals with my weight. It lets me set goals with my sleep. It even tells on me if I take a nap. so, so I can't, that's one of the good things. And I think it makes me, it makes me be more in tune with what's going on with myself. And not only does it have me being more in tune, it also has me, I also realize, like, oh, okay, I guess kind of in this perspective, hey, they're watching. So, I got, it makes you be, I'm trying to think of the word, you have to really pay attention on it, and just go from there, and definitely work with everything that's going on with you. So the other thing is too, is that with my heart failure, for me, my what was told to me from my doctors for is why I personally deal with heart failure is I have a family history. My grandmother passed away from what I have. My grandmother's mother has it, and recently diagnosed now is my mother has heart failure. So it kind of just comes down the line. And most folks, most folks that deal with this, I don't think they really understand the importance of knowing your family history, and just knowing and understanding, the different health conditions that's out there to really get checked for, and to really deal with. With me, a couple of years prior to getting diagnosed with heart failure, a few years prior, my apologies, I actually went through cancer. So my heart failure comes from a mixture of family and chemo. Because as we know, the chemo is really hard on your body, but it gets the job done. I think one of the things for me with heart failure, it was dealing with chemo was very difficult. So for me, understanding, or when I got heart failure, I think the biggest thing for me was really understanding what was going on with myself, because I'm like, okay, I've been through this. This is something I can deal with. I've been through this before in the realms of something dramatic health wise. But I think the real key that folks need to understand is heart failure isn't something that you get cured from. It's something that you manage. So you learn to manage your life better with the way that you eat, and you manage to just really, if somebody else that's out there, definitely just be an advocate. Say, hey, you really should get yourself checked, go to the doctor. And I think also it's important understanding, symptoms to look for. For me, I was just really exhausted, and abnormally exhausted. So my doctor brought me in, my primary doctor, she brought me in. She listened to my heart, did blood test, and within a few days, they had me going over to a cardiologist. At that point of time, once I went to the cardiologist, I was there to have a conversation, and they let me know that, hey, we have to start treatment right away. When they found out my heart was working at 20%, when they got me, between 20 and 25%. And, you know, normally, as we understand, our hearts never work out 100%, or it's in rare cases. Um, but overall, from, you know, that explained why I was exhausted. That explained, because you notice as you get older, you do a little weight gain. You know, you gain a little weight. That's, you know, coming with age. um, and you know, for me, all of these signs that, you know, I chalked off as, okay, I'm just working a lot, I'm this a lot, I'm that a lot, were really signs that, you know, I needed to go and get myself looked at, which, you know, I felt myself that. Um, and one of the things that I'm happy about now is, now anything, I notice every little thing. And, you know, I really like that I became like that, because of the fact that, you know, it's one of your good reasons for being here is paying attention to what your body tells you, because your body will tell you if something's not right. One of the things that I do in order to, I try to do a lot with the American Heart Association, because I feel that um, these folks here have really given me a second chance, because of the fact that when I was first diagnosed, I really didn't have anybody to talk to. And the stuff that you see on the internet definitely needs to be updated, because when I was first diagnosed, I was 39 years old. So being a 39-year-old woman with children, looking at a computer telling me that I had a possible 5-year lifespan was not very promising. And it was very, you know, it was like, wow. And then once I got involved with the American Heart Association, you know, I got more up-to-date information that was explained to me, hey, there's folks that are here 20 years doing work in so I do think it's important that, you know, that as healthcare providers, if, you know, if I definitely see information out there, you know, just definitely keep the information up to date as possible. Just for, you know, definitely for patients, because it's, you know, kind of looking at stuff like that kind of bothers you. And one of the main things a lot of patients do, especially in our age of technology, we go and we look at the computer first. We go and we look at the internet first to see what it says out there. Regardless of what our doctor has said to us, we will still go and look on the internet. And unfortunately, I hate to say, when we go and do that, it can be the most depressing thing, because, you know, there's, as I stated, information out there that's outdated. The good thing with the network, we meet people that are our age, younger. We also have folks that's out there that we interact with, that we see, that are dealing with what we're dealing with. So it gives you some time to actually focus on other things versus yourself. One of the last things that I wanted to discuss and talk about was yearly, I put together kind of my passion of writing. And what we do is we kind of do a yearly ride. And one of my hopes is I'm getting this very big. And I would love to definitely, you know, see to get more patients in. And I do this in Woodbridge, but eventually I'd love to do this everywhere. One of the things, you know, again, as I stated, I'm a huge motorcycle enthusiast. So one of the major things that I'm going to be doing is riding to Sturgis. So this year for me, that's a really big deal, because that's going to be my longest ride that I've ever rode while dealing with heart failure. So I'm definitely excited about that. It was a pleasure to speak with everybody, and I just want to tell everybody thank you for your time, and thank you for all that you do for us heart patients. Even if we don't tell you, we truly do appreciate it, and it takes a special type of person, or a special breed of a person, to really sit there and interact with us, because I know as patients, and I know myself especially, I have my good days, my bad days. I know I have my days that I bother the heck out of my doctor just for small, mediocre stuff that in our head is major and dramatic, but in the end of the day, it's, you know, it may not be, you know, most of the time it's not a big deal, but we really truly do appreciate you guys. And with the American Heart Association, I truly do appreciate them. That's all I have for this afternoon. Thank you, everyone.
Wow, thank you so much, Amy. And thank you, Preeti, as well, for sharing all of the resources. Right now, we're going to open it up to questions from the audience. So if you have any questions, feel free to unmute yourself and ask them, or you can type in the chat box as well. I have muted everybody, so you will have to not only unmute your phone, but you'll have to unmute on the Zoom control panel as well. So I know I have been a person that has tried to talk and be like, why can't anybody hear me? So that there's 2 unmutes that you'll have to do. I don't see anything coming in, but Preeti, do you have any follow-ups for Amy, or Amy, any follow-ups for us?
No, Amy, thank you so much for sharing your story. I think you brought up a great point. There are good days and there are bad days, and what you live every day is inspirational. And I'm so glad that you had a chance to speak about what you do to help you get, about speaking to your provider and your care team, and monitoring your symptoms and just being on top of it has really been key in helping you. So I'm really happy that you were able to share your story. I know today you weren't feeling too good, so thank you so much for giving of your time. For everybody else who's on the phone, thank you all. Jen, thanks so much for this opportunity. If there is anybody who's interested in learning more about, HF Path, or how we can help you with your clinic to use it, or, if you'd like a personal demo, please feel free to contact me. And Jen has my contact information. Thank you again for your time and spending your lunch break with us.
Yes, that was a great wrap up, Preeti. Thank you so much. I do want to remind everybody that our next webinar is July 26th. Oh, I guess I can share this. And share my screen. I'm walking myself through this. All right, there we go. It will be at noon on the 26th. This will be heart failure, palliative care, and heart failure critical conversations that always succeed. The program overview is patients are at the center of care. Engaging them and their family members in determining their care prior to an emergency is best. This allows for rational, informed, and conducive shared decision-making for the future. The objectives are summarizing palliative care for improved patient and family experience, describe advanced care planning, and the importance of shared decision-making. We have Dr. Mosier that will be presenting that day, so please join us. You will see those registration links come out. If you do have questions, though, feel free to contact me in regards to that, and I will go forward on my slide so you have that. You can email me, you can call me, and I will make sure that you guys get those registration links. Otherwise, we will send out another MailChimp as well. So thank you, everybody, for your time today. This will be recorded, so anybody from your clinic that where it was not on here today will be able to access this at a later time. So thank you, everybody, and have a good one.
Thank you, Jen. Bye.